Have you ever been washing your clothes when all of a sudden the washing machine starts going clunk, 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 and it gets super crazy and the whole thing starts shaking and you run over to it and open it up and all of your clothing is on one side? And then you move your clothing so that it's around the edges of the washing machine and close it and start it back up and it works. This is a washing machine misalignment. And according to the Journal of Neuroscience, published in association with Northwestern University in an article published in 2008, the brain has similar cycles to a washing machine. And certain mental health disorders can misalign it just like a washing machine, but it can actually cause brain damage, which is why it's so important for mental health professionals to find ways to cure the misalignments in the brain. Today, I will be looking at different proven scientific ways of realigning the brain. Specifically, I will be looking at hypnosis. Let's begin by looking at what hypnosis exactly does in the brain. Think of your brain like a city with lots of different buildings, all connected by communication structures very similar to telephone wires, and they're communicating all the time. In 2016, the Stanford Medical Center actually did a study to see what hypnosis does to the communication states of your brain versus resting, and it found three main differences. The first difference they found was a decrease in the salience network of your brain. The salience means prominence or importance, so you can think of the salience network in your brain like a government in your brain. And when there's decreased activity going on in there, there's less overall decision making during hypnosis. The second communication change that they found was decrease in the self-analyzing part of your brain. So instead of having anxiety over actions you might be taking or decisions you might be making, your brain is not reflecting so much on what it's doing. And there's less overall mind wandering. The third change in communication that Stanford found was an increase in insular function. Now, there's two insular functions on both sides, one on both sides of the brain, and it is in charge of body-mind control. In an article published in 2017 by the Journal of Clinical Neurophysiology, an official publication of the American Electroencephalographic Society, the insula is in charge of taking feelings from within your body and outside of your body and using those to change your body so that it responds to this environment. So if you have increased insular functioning, that means you have more control. The brain has more control of the body. Now that you've seen what hypnosis does in the brain, let's take a look at how hypnosis actually realigns the brain. Specifically, let's look at the misalignment of chronic pain, because according to the Journal of Neuroscience, which I referenced earlier, this is one major cause of misalignment. Hypnosis resets the cycle of your brain from the chronic pain. How exactly does it do this? Well, earlier I discussed how the government functioning in your brain is decreased and the overall self-analysis in the brain is decreased. Both of these lead to the brain focusing more on other things, specifically the insular functioning, which means that overall the brain is focusing very much on controlling the body. This can be used by the hypnotist or the therapist to decrease chronic pain. According to an article of the University of Washington in 2014, there are two main ways that hypnosis can be used to do this. The first is that by using all of this focus, hypnotists or therapists can focus on 5 major places in your brain. There are 5 major places in your brain that process chronic pain, and hypnotists or therapists can focus on each of those specifically to decrease the overall intensity of the pain. The second way that this article says that hypnosis can decrease chronic pain is by simply changing the brain state. When the brain is resting, it is communicating a certain amount of times per second, and when it's in pain, it increases that. So every second there's more signals being sent. And according to the Journal of Psychotherapy and Physical Rehabilitation published in 2017, the higher communication leads to more anxiety in the brain. And this anxiety can actually lead to a perception of pain that's not actually there, but the brain perceives pain as if it was there. So overall, lowering the communication the amount of communication per second in the brain can just decrease the perception of pain in a person. Now that we've seen what hypnosis does in the brain and how this can realign chronic pain, let's take a look at some examples of this. In 2006, there was a study done by the British Society of Gastroenterology that studied chronic pain patients, and it found that after 12 sessions of hypnosis, 80% of the patients who had these sessions had improved their state of health and decreased the overall intensity of their chronic pain. In 2009, the International Journal of Clinical and Experimental Hypnosis studied MS patients, or multiple sclerosis, who had chronic pain as a result of this disease. And they found that 87% of the patients who had hypnosis treatment improved by at least 30%, and their chronic pain intensity went down. The Journal of British Society of Experimental and Clinical Hypnosis in 2009 looked at a bunch of other studies very similar to these and found that chronic pain has been seen to relieve hypnosis has been seen to relieve chronic pain in multiple ways, such as chronic headaches, chronic lower back pain, chronic arthritis, chronic fibromyalgia, which is muscle pain, or cancer-related chronic pain. And it's been found to be more effective than no treatment, than standard care, and than treatment without hypnotic elements. So today, we have learned about resetting the brain. Specifically, we've learned about how hypnosis resets the cycles in the brain, how chronic pain gets reset by hypnosis, and how studies have shown that this actually works. The brain is a little bit more complicated than a washing machine. But as humans, neither one of those are very good things to break. Thankfully, medical personnel is working on ways of realigning the brain. Thank you.